95.9 Seaview Radio, smooth and relaxing favorites. The Morning View with Jay Zeger at 8:14, and my special guest. That was loud. Wow.
Well, we have a guest in the studio.
We do, and apparently he hasn't done much radio. Holy cow.
When you gotta sneeze, what do? You gotta sneeze.
I guess you do it. In the future, let's turn away from the microphone. All right, Emily Pantelides, my special guest host, in here with me for the week, and we have a special guest in the studio today, Dr. Canassi.
Dr. Javier Canassi with the Canassi Medical Institute. Thank you for being here today.
Good morning. Thank you
So
for having
I
me.
actually think it's kind of a privilege to have Dr. Canassi in because he doesn't do a lot of media interviews. However, word on the street, if I can use that expression, is that you're kind of this weight loss expert in town. Everyone's going to you for weight loss, and I heard about you, and I just want you to tell me the secrets to losing weight. I want to know what everyone's saying, why you're so great, and what the big deal is.
Well, as a medical internist, I have a unique training and capability of developing a program that's specifically designed for you as an individual. After many years of training and many years of treating medical patients, I've developed an ability or an insight in how to motivate and how to develop a weight program that's designed for you as an individual.
So are you is it a plan like the same thing for everybody?
No, every single plan has to be designed for you. Not one plan fits for everybody. There's not a single template. Some people like to do more exercise. Some people like more diet, more restrictive calorie intake. So you really have to develop it for your likes and dislikes and taking into account what your preferences are.
So basically, are you going to tell me to eat right and work out? Because I've heard that a million times.
No, I'm going to teach you how to lose weight by embracing a healthy lifestyle.
Now, the reason we brought you in here was Emily and I were talking. Emily just had a baby 5 months ago. So Emily has said that she's having trouble losing that baby weight. And I feel for women that have to go through this, that you fight so hard.
It sticks. For some reason, it's there longer than, you gain a couple pounds, that's fine. But for some reason, I just can't get these last, if I'm going to be honest, they're probably 15 pounds left from the, God, I'm telling everything now, but they're probably 55 that I gained when I got pregnant.
And it's hard to lose that weight, isn't it?
I'm telling you, there's something about it. I don't know. After having a baby, it's like stuck in weird places. I don't like it.
It does take a little while after you have a baby. Those are some tough situations when you're trying to lose weight, but if you're patient and you stick with it and you just allow time to materialize, you will lose the weight.
I don't have patience. I don't have time. I'm one of those people. I want it tomorrow. I want to go to bed and wake up thin.
So you want a 1 week remedy?
Yes.
Doesn't exist.
Oh, great! I thought you were going to get me all excited.
Now, some of this though is it's really just your genes, isn't it? Because I know there's a friend of mine who she has had 2 babies now, and she still is in excellent shape. And she said, I didn't really work out a whole lot after the baby. I did a little bit, but she told me, she said, it's just my genes that I'm able to lose that weight very, very quickly. Some people, they're going to gain that weight, and then they're not going to lose all of it again. It's like, that's the way your body goes, isn't it? You can fight that all you want, but a certain part of it, that's just the way your body is,
remember,
right?
we're all born with the ability, we're all born thin. Or some babies are born overweight, but we have all the ability to remain thin. Now, there are some genetic predisposition for people to gain weight, which are medically derived from. There are secondary causes for weight gain. But for the most part, we all have the ability to maintain adequate weight.
So what you're saying is if we do the right things, if I go back to doing a certain thing, you can keep the weight off?
Yeah, and if you look at the data, if you look at history, look at what's happened since computers came on and kids are on the computers and exercise has been diminished in the schools. Look at the obesity in kids. It doesn't take rocket science to figure this out. Right. Kids today eat more processed food, more sugar content, they exercise less, they're in the computer more often, and the end result is that we're seeing diseases that typically occurred in adults like type 2 diabetes now occurring in young adolescents. That's all derived from obesity.
Yeah. The thing is, so we're talking about me having a 5-month-old. I'm thinking about things to feed him. We're already mashing up foods and things like that. And I'm thinking about how eventually as he gets older, I want to make sure he sees me eating fruits and vegetables so he'll eat them more. They kind of mimic stuff. It's just hard.
So I try to emphasize that on my patients when they're trying to lose weight. And I tell them, for you to do this, it's not only for you, but it's also for your family. Once you do it, right, everyone else in the household will embrace it, and everyone then is healthy. But there's no doubt the American Heart Association recommends an hour of exercise every day.
Okay, so
An hour of exercise
An hour
every
of
day?
exercise
yeah,
every day.
An hour. That's a lot of exercise.
So that's probably not realistic, but you could probably do 3 hours a week. And if
Yeah.
you do 3 hours a week, and I mean not walking your dog, because your dog can't walk you, okay? We mean 3 hours a week of intense cardio and resistant exercise.
So that means weights too?
You have to do weights. If you don't do weights, you don't really, personally, if you don't do weights, I don't think you get the maximum out of it.
Okay, all right.
No,
so
weights weights allow you to stretch the muscle fibers, and then that process of repair activates your metabolism. So when you do weights, you're basically activating your metabolism a lot longer than when you're doing just plain old aerobic exercise.
Yeah.
Specifically when you emphasize the largest muscles in our body, which is our legs. How many people like doing leg exercises? Very few. But the leg exercises are very important. You must exercise your legs.
Okay.
Squats are the best thing you can
Squats
do.
are the best thing. Very painful the next day to get out of bed. But
Yep.
Squats. All right, I can do some squats.
All right, so we're with Dr. Javier Canasi, and Dr. Canasi's talking to us about losing weight. You know, Emily was focusing on trying to lose that weight after having a baby for 5 months ago, trying to really focus
But
on
I
getting
am exercising and working out. I don't know what's going on. I mean, I did mention earlier I have a sugar problem, so
Yeah.
I mean, maybe cutting that out will help. I feel like I'm getting shamed into it now, though. My goodness.
It's the pressure of it. What's okay now, Dr. Canasi? We were talking earlier. What's the difference? It's easier for a man to lose weight than it is a woman. Like I was telling you before, I can lose 15 pounds in probably a month or less if I really put my mind to it.
Now.
I could. I'm sorry, but there's a big difference in a man being able to lose it and a woman, right?
Well, absolutely. There's no doubt in my experience, men tend to lose weight a lot quicker. So when I have a couple and they're both trying to lose weight, I always tell them to compete, but don't compete in a friendly manner. Don't shame each other into losing weight, because I know that the husband usually will lose weight a little quicker than the wife.
Once again, we get the raw end of the deal, us women. How does this keep
Yeah.
happening?
Genetics.
Great. Genetics.
All right, so if you want to talk to Dr. Canasi, 1-877-960-9960. We're talking about losing weight, how you can lose that weight the correct way. We're also going to talk about kids exercising when we come back in also. So again, if you want to call into the doctor, 877-960-9960.
Yours is the sugar.
I know. I need to stop.